Honorable Speaker, the second area you told me to address through the letter from Parliament was the preparedness of the public health facilities, the isolation units, the medical facilities, and trained personnel. Honorable Speaker, the House specifically requested a report on the level of preparedness of public health facilities, including isolation units, medical facilities, and trained personnel. And I want to confirm that the Ministry of Health has undertaken facility readiness assessment and continue to strengthen capacity at the national referral facilities and in counties considered at high risk. At the national level, Kenyatta National Hospital has prepared an 8-bed isolation and treatment unit and completed a dry run of how the index case will be handled. The facility has a separate waste management system to support the safe handling of infectious waste. The National Police Service Hospital has been assessed and has 49 beds ready for activation as part of the surge isolation capacity. At the county level, 29 counties have identified designated isolation and treatment sites. The Ministry of Health, the Kenya National Public Health Institute, and relevant regulatory agencies are undertaking on-site verification, quality assurance, spot checks to confirm that these facilities meet the required standard for infection prevention, control, patient flow, waste management, staff protection, and emergency referral. Honorable Speaker and members, these facilities are part of Kenya's national public health preparation architecture. They are not established for exclusive benefit of foreign nationals, foreign governments, or any special category of persons. They are intended to protect all persons within the territory of Kenya, including Kenyan citizens, residents, refugees, visitors visiting our country, diplomats, expatriates, and any other person who may require isolation, testing, or treatment based on the medical need and public health risk. This position is consistent with the Constitution, the Health Act of 2017, the Public Health Act, and the International Health Regulation 2005. If any person is identified within Kenya as a suspected or confirmed Ebola case, the correct public health response is to safely isolate, test, treat, and trace contacts within the jurisdiction where the risk is detected. On personnel readiness, Kenya has mapped a surge capacity of 241 expert responders comprising of 51 epidemiology and laboratory training program, 118 African volunteer health corps professionals, 72 basic health emergency management specialists, and these teams are on standby for deployment to support surveillance, contact tracing, case investigation, laboratory diagnosis, and field responses. Additionally, 1,069 national and county health workers have been sensitized on Ebola preparedness and response through a very structured virtual sessions. On-site training and simulation drills have been undertaken in Busia County and Busia border, where 60 health workers have been trained, and additional exercises are going on. Our plan for the county of Turkana and Trans Nzoia. A national tabletop exercise is scheduled for 15th to 18th June 2026 to test coordination, referral, laboratory, and response. Thirdly, Honorable Speaker, you have asked the measures we have activated as a ministry, which I have really enumerated.